so as you can see, the individual really, as this graphic from Cell magazine shows, we're going into health 2.0 or 3.0, and the actual individual now is multi-layered, even introducing the social graph like Facebook, YouTube. It's part of the individual now, the different biosensors, the genome, the proteome, the metabolome, microbiome, and all different things that form the individual. So one example is the microbiome, which fascinates me because the human body has 20,000 to 25,000 genes of our own body, and it has 8 million microbial genes. So we have 8 million genes of microbes in our body. That means 8 million different microbes and bacteria in our body, while our own genes are 20 to 25,000. So, and this is because bacteria works with the human body to digest food and do other things. So this is even a new layer of looking at the human body in different layers of course, all this technology produces enormous amounts of data. To transform that into actual knowledge really would take something like an artificial intelligence to be able to sort out what this data means. So this slide shows different types of intelligence. Where we are now in the industry is the narrow intelligence. It's basically reinforced learning or pattern recognition, as the slide, looking at the Chihuahua dog and the muffin and differentiating between learning. So the artificial intelligence learns how to accurately differentiate between these different images. Of course, all this data also accumulates, like the Amazon and the Facebook, they accumulate enormous amount of data personalizing you, so they know what type of books you want to read, what type of merchandise you like to buy, and all this stuff. So this is just an example of how artificial intelligence secures and uses its data. And of course, this is used in different forms of medicine. The new type of artificial intelligence is machine learning, and this is moving to a different level of looking at the data, where the machine itself, rather than pattern recognition, it develops certain algorithms really beyond the scope of this talk, but very interesting going into the future. One of the very abundant or famous in medicine is the IBM Watson, which basically collects data from the human, whether it's genetics, clinical, different x-rays and images, and then compares them to all these available articles and guidelines and all of this, and can simply come up with the best possible management plan. This was the idea for the IBM Watson, but unfortunately there are drawbacks. And MD Anderson was trying this. It's one of the biggest oncology hospitals in the world, and it didn't turn out as we wanted, but they're getting there, improving the data sets and so forth. And this is just a cartoon that, artificial intelligence really has a certain way. You have to frame the objective for the artificial intelligence and not expect things that it's not understanding. So if you say eliminate environmental crisis, and actually we are the problems of the environmental crisis as humans, and the machine can come up with, okay, so the solution would be destroy humans. This is just a cartoon I did to show you the dangers also of artificial intelligence if it's not framed correctly with the proper objectives. Of course, with all this data comes hacking and information security. We have all seen the Cambridge Analytica and weaponizing this data to hijack hospitals. And this is an industry also that's very interesting to understand.